She's a real woman with a real life. She's someone you can relate to. Dawn Newton.
Hey, welcome to the Dawn Newton Podcast. I am your host, Dawn Newton. I'm excited about my guest today. Dr. Michelle Jackson joins me. She is an Oregon State licensed naturopathic physician. She's been practicing in Bend for about 23 years. Full disclosure, she is also my physician. Dr. Jackson specializes in male and female hormone imbalances, thyroid and adrenal issues, food sensitivities, and neurotransmitter disorders. She's also got a couple free lectures coming up in January. January 20th is the first one, Saturday, January 20th at 10:30 a.m. She'll be talking about bioidentical hormone replacement, and this will be really beneficial for Peri Menopause or menopausal women, but actually anyone who's interested in learning about the role of hormones in the body. Her second lecture will be Thursday, January 25th at 6:30 p.m., and this one's going to be about adrenal and thyroid disorders. Those glands are so important in the body, common symptoms and treatments associated when maybe these guys are out of whack. Michelle Jackson, like I said, she specializes in this arena. And if you're experiencing any symptoms where you're feeling lethargic, anxious, depressed, maybe some weight starting to creep on you, or you're not finding the joy or the passion in things that normally you're excited about, where you're feeling just a little, blah. You're just sitting there scrolling on your phone. You got the remote. You're just changing channels on the TV. You don't really want to get up. You're not really motivated. Those are kind of the telltale signs that something is out of whack. And yes, there could be some external things like world things, life things that are doing that. But when we get stressed and the life things are happening, it will put a stress on the hormones, the adrenals, and the thyroid. So if you are feeling any of those things, I would encourage you, one, to listen to this conversation that I'm having with Dr. Jackson, and two, reach out to her. And we'll give you all of her contact information and everything that you need towards the end of our conversation. And then also we'll give you information on the 2 lectures coming up here in January. Dr. Michelle Jackson, it's great to talk with you today. You've got a couple lectures coming up that we're going to be talking about here. The first one is Saturday, January 20th, and then again, Thursday, January 25th, that we're going to get into here in just a moment. But I just want to introduce everyone to you. You are a Oregon State licensed naturopathic physician. You've been here in Bend for, the math I did was close to 23 years or so?
Yeah, exactly. I graduated from the Naturopathic College in Portland in 2001 and came over here right after that. So, yes, I'm dating myself. 20 years.
Well, and also it just made me think about, too, in that time, how I'm sure you've seen the medical arena, how it's the ebbs and flows and the changes and advancements and all the things from when you first started to where it is today. I bet I don't know if that's been significant or if it's been subtle or how that's been.
Yeah, that is an interesting question. I'm not going to have the exact numbers. When I first moved here, I think just from the naturopathic perspective, I think there was 5 practicing naturopaths in Bend. And years ago, I want to say it's probably been about 10 years ago, I looked because I was just curious. And there was 25 of us. So, and probably even more now. So the naturopathic community has really grown. And then from a perspective of blending, I shouldn't say blending, but for me, getting referrals from MDs and the traditional medical community, that's really changed in a positive way over the years. In that, now I'll get referrals versus when I first started, no one was sending naturopaths any patients our way. So I think there's been some growth, which is really nice.
Well, and that is interesting how that happens, and I guess I can label it Western versus Eastern medicine, I think is how it's looked at.
Sure.
Please correct me if that's incorrect. But yeah, that it is interesting how our more traditional physicians aren't as accepting or open, but they have, I've just in my own personal experience noticed some changes there, but not everywhere.
Yes. No, I would agree. And just to back up, I'm sure some of your listeners might even not know what a naturopath or naturopathic doctor is. In Oregon, we're full primary care physicians. So we can prescribe everything that traditional medical doctors can, but the big difference, I feel, is we're also trained in herbal medicine, and I didn't, but some naturopaths also get their acupuncture license. As a naturopath, it really is a blend between Western and Eastern medicine. There's a broad range of the way people practice. Like I have some naturopathic friends who are very Western. Like they just go ahead and prescribe medications just like an MD would, versus I have other friends who they don't use their prescription rights. They'll just do herbal and vitamin. I tend to be in the middle of the road. So yeah, it's a great field, or what's the word I'm looking for? A great profession. I feel like you can really individualize your practice how you want it to be.
Well, too, in reading just in our talking points and my research on you, just naturopathic medicine, and I think this definition applies all across the board, aims to treat the cause of an illness, not just the symptoms.
Yeah, exactly. I looked because I was like, I need to refresh myself with this. There's a few naturopathic principles. One that's in like all of our literature. One is the healing power of nature, and how I read that or interpret that, sometimes thinking about the healing power of different herbal medicines, but also just that our own body has the ability to restore itself and ward off disease. Then another naturopathic principle is first, do no harm. So that's looking at like, hey, we do try to do the most gentle treatments as possible, or say I do prescribe antibiotics for someone for strep throat, I also wanted to probiotics or give them the things that might counterbalance any side effects from the medication. One of the biggest principles that really drew me to naturopathic medicine was what you just said: identify and treat the cause. Because really, if you think about it, if you have, a headache, that's a symptom of something else out of balancing your body, and you want to find out what is causing that headache. Is it food sensitivities? Is it a sinus infection? Is it neurotransmitter imbalances? And I'll just keep going. And then the other two naturopathic principles, one is prevention is the best cure. So obviously trying to prevent disease, and then you don't have to treat it if you don't have that issue to begin with. And then this goes back to my lectures. The last one is doctor as teacher. In general, and I guess I can't speak for all naturopathic medicine, but most of us spend a lot of time with our patients. I mean, I think the average time that traditional medical doctors spend, I think sometimes I see there's 7 minutes or 7 to 15 minutes per visit is what they're allotted, versus I think most naturopaths are scheduling at least 30-minute follow-ups, an hour follow-ups. And that's because we need to take the time to tell our patients or teach our patients about why they might want to do these therapies. Because I'm not going to go home with all my patients and make sure that they do everything. They have to kind of know why. That would be important. So I think there are just some fundamental differences between Eastern, Western medicine.
I mean, and that's that whole health piece of it. I mean, nutrition and the physical, the lifestyle, homeopathic medicine, botanical. I mean, all of it, the psychological too. I mean, it's, I guess, mind, body, spirit is what seems to come to mind, but there's so much to it, that balance. And our body is such a machine. It's not just, like you said, here's the headache, but what's causing the headache?
Yeah.
And so let's lift our hood and see what's going on inside, which sometimes that might be a scary thought, but we do need to figure out, what's going on and how much control we have over our own health.
Exactly. And like, as you mentioned, where you just said, like the spirit and spiritual part, in that I think we all can relate to this, that you can't separate out your physical symptoms and say, oh, that's not affecting my mental health or my spiritual health. Oh, it is. I mean, if you've got this pain, this back pain, it's going to make you grumpy. So it's just looking at the whole picture. And our bodies are amazing because they have this ability to heal. It's all interrelated. It's very difficult to just look at one little box and just treat that, because it has a broad, anything you have going on with your health is going to have a a broad-reaching effect.
But, and thinking about we'll use a headache because that's real simple and we can all relate to it, is that we're still going to take the ibuprofen or whatever it is to try to get that pain to go away. But at the same time, while you're doing that, let's look even further. Let's peel back some more layers while we're trying to get that headache to go away and then figure out what's causing it. Because sometimes those headaches can hang around for a long time, turn into migraines and all kinds of things that can be pretty debilitating.
Right, exactly. Yeah, and I think it's easy to get in the habit of, I woke up with a headache and I'll just take my, ibuprofen again. And then, just sometimes it's sitting back with a patient and I'll ask, well, how long has this been going on? Does this happen every day? And sometimes those questions are like, oh, yeah, I didn't realize that I've had this headache every day, or it started when allergy symptoms start, or just things. Sometimes you just have to take the time to ask these simple questions, but they can be so revealing. It just helps people realize they can make the connections, or my patients can make the connections as I do at the same time.
And the thing too, I want to make sure that we talk about too is like you said, and we said it earlier, and you said it earlier, was that blend between Western and Eastern type medicine, and that you do work with primary care physicians and the referrals back and forth. So it's not, you don't need to pick a side, which sometimes I feel like our Western physicians do want us to pick a side.
Yeah.
And I don't mean to demean or, disparage that, but I mean, just from my own personal experience too, it's like, well, why can't we do both? Why does it have to be one or the other?
Yeah. And I hear that a lot from my patients, and it is frustrating for them. They'll ask me, they'll say, oh, well, do I tell my primary care that I'm working with you for whatever we're working on? And my answer is always like, yes, they need to know. But they do tell me, they're like, okay, but I might get some resistance about this. But on the other hand, I tell them tell my patients, it's their body. I mean, I don't want them to do anything stupid, but with the right knowledge, you should be able to decide what works for you and what you're comfortable with. But yeah, I do hear that a lot from people. They're just like, oh, I don't know how my primary is going to like this, but that's changed. But like I said, there are, quite a few physicians in town who don't do a lot with male or female hormone replacement, and I do. And so over the years, I get referrals for that now from them, which is really nice.
I wanted to talk to you about your practice, because your practice it's a specialized practice, and you've changed your business model over the past couple of years, but where it's telemedicine practice and the focus on male and female hormone imbalances, thyroid, adrenal issues, food sensitivities, neurotransmitter disorders. We'll have to define that one because that sounds really that sounds very Elon Musky, I guess. It's like, ooh, my neurotransmitters. But that has changed. So tell us about that process and how you like doing that.
Yeah. Oh, I'm glad you asked. So, yeah, as we alluded to earlier, when I first started practicing, so probably for the first 20 years of my practice, I did in-person primary care, which was... There's a lot of aspects that I loved about that. But as I mentioned, as naturopaths, we can prescribe medications. And so say I started out with someone who had high blood pressure. And at first we were treating it just fine with herbal and lifestyle changes. But then if their blood pressure kept increasing, I'm kind of obligated to, put them on blood pressure medication. And not that I was against that, but with being primary care, it was just a lot because, anything that came into the office, I had to know, okay, this is the traditional way we treat it. This is the naturopathic way we treat it. And there's so much new information coming out all the time. It was becoming difficult to keep up. But then COVID hit, And I think COVID changed things for a lot of people. And I started to reevaluating, like, what do I really love to treat? What do I want to really treat for the next 20, 30 years of practice? And throughout the years, I did a lot of hormone and thyroid patients anyway. And I do love to treat that. So I was like, you know what? I'm going to kind of pivot, try to specialize in that more. And so what I did is I require that my patients have a primary care physician, because I'm telemedicine, which I'll tell you about more, but they still need to go in and get their physical exams and their blood pressure and things that if we can't work ideally with naturopathic medicine, then they can get the prescriptions from their primary. So it was simplifying. I was just ready to simplify a little bit and treat the things I love to treat. And telemedicine just pretty much means that it's not in person visits. I do either over the phone visits or video visits. I don't use Zoom. I use this other platform called GoToMeeting, but it's basically a Zoom call. So I can at least see the patient and they can see me, and that always is a nice connection as well. So that's how it works. It has simplified things a bit.
Telemedicine. So have you noticed a change? Has it impacted either from your standpoint or a patient standpoint, the quality of the service that you're providing? Because, full disclosure, I'm one of your patients and it's been amazing.
Well, it was funny. I had one patient, they live out in particular, I'm thinking of, they live in Christmas Valley, and I treat their whole family. And at first she was like, not thrilled with the telemedicine thing. And then I think the second time I talked to her, she's like, this is great. She's like, I can't, they were haying, they were like in the middle of, big hay cut. And she's like, I just have to take a break and then I can have my visit and I don't have to drive into bed. She's like, I love it. But it does take away, like I do, especially my new patients, I do miss meeting them for the first time. I think it does take away a little bit of that connection. But for the most part, people really like it. Everybody's like, sure, I can keep doing that.
And talking about the specializing, doing what you love to do, focusing on male and female hormone imbalances. Mm-hmm. And, when we talk about hormones, we always think it's more a female situation. But men, you have hormones too, and they do change. And how we use our hormones and how stress, contributes to those imbalances. And even as we age, our lifestyle, there's so many things that I don't think we realize. Sometimes I think we just chalk it up to, well, I'm getting old. This is what I'm supposed to do. Which I'm like, stop saying that, because that's not accurate. There is some changes, but there's things that we can do to still, have a quality of life and fulfilling and getting those hormones so that we're still active as we want to be.
Yeah, exactly. I do overall, I treat more women than men. I think in general, women probably go to the doctor more, but this is funny. This often happens. I'll treat the wife or of the couple for hormones, and then they're feeling a lot better and they're like, okay, husband or partner, you got to go in and get that testosterone check because I feel so much better. But yeah, men, and it's particularly testosterone, tends to drop, or does drop with age. And just like women, our hormones really start to shift and change in your 40s and 50s. Men will often have that drop during that time too. And it's particularly testosterone. So a lot of times, the first thing that comes to mind, men will think, about like, but my libido's fine, so I can't have low testosterone. But testosterone is, it's a brain chemical. We have tons of receptors for hormones in our brain. So the lower testosterone levels sometimes they're feeling kind of depressed, or they're tired, or they're not building muscle mass. And just testing those levels and getting those more optimal makes a huge difference in just, mind, body, spirit, all of it.
Well, and thyroid and adrenal issues, that's one that's clearly near and dear to my heart. Are you seeing a lot of that? I know, with hormones, thyroid, adrenal, our food sensitivities, that seems to be, I guess I'm going to say common, or we're seeing more of it.
Yeah.
And what's the underlying cause of it? I mean, I have my ideas, but...
Yes, the thyroid and adrenal disorders. Oh, I don't know if it's become probably more prevalent in our society, or we're just more aware of them. But I definitely feel like there's so much stress. There's so much going on. And even though we talk about the adrenals producing too much or too little cortisol, and they do, but they're directly responding to the brain. The hypothalamus and the pituitary glands in your brain is what tell your adrenals whether they should make cortisol more or less, or the imbalances there. With our very busy society, I think that stress has caused more adrenal dysfunction. And that's something I definitely think people maybe can relate to. They might go to their regular Western MD doctor and they'll test the adrenals. And unless you've got it's called primary adrenal deficiency or Addison's disease, where your adrenals just doesn't make cortisol anymore, they're going to say, nope, your adrenals are fine. But for most people, their adrenals are functioning, meaning they're not shut off. They're not no cortisol, but they're not balanced. They're not ideal. They're not functioning ideally. And I think that's a great place that alternative medicine can come in and be like, you're not in this disease state, but they're not functioning ideally the way they should be. And same with the thyroid, in that there's very big ranges of normal, I feel like, on the blood work for thyroid. So oftentimes I have people come in and they'll be like, oh, I'm tired, I gained weight, I've got dry skin, I'm feeling low mood. They're all symptoms of low thyroid. And they'll say, oh, but I have my thyroid checked and it's within normal range. And I'll look at the labs and I'll be like, you're in the normal range, but not anywhere near an ideal range of normal. Or they haven't, or their tests don't look at the whole thyroid picture, because there's a lot of additional tests that can be brought in to look at the big picture. I don't want to blame it all on stress, but there's a number of reasons why these glands, I feel like, are getting more and more out of balance for people.
What exactly do the adrenals do? Like, I understand they're located on top of your kidneys. Is that right?
Yeah. So there's these little glands, exactly on top of they're not connected to kidney function, but they sit right on top of your kidneys. And they actually do a lot of things. I mean, one part of the adrenals, it controls sodium, potassium, and some electrolyte balancing, which people don't always know about. But sometimes that's a signal for me. If someone's like, I'm getting dehydrated all the time, or it's one thing that I go, I wonder if we need to look at your adrenals. But they also produce cortisol, which most people are familiar with. Cortisol is a hormone and should have a rhythm where cortisol should be high, elevated in the morning, and then slowly slope down and be low at night, because it gives you energy for your day. So you don't want your cortisol high at nighttime, because it certainly can affect your sleep, or low in the morning, because your metabolism and energy can be low for the day. And then the adrenal glands also produce epinephrine and norepinephrine. Well, actually, I shouldn't say that. I think it might only produce norepinephrine, and it's converted to epinephrine. But anyway, with those two neurotransmitters or brain chemicals, which are similar to adrenaline, so it also helps with, or it's involved with that fight or flight response. So yeah, the adrenals do a lot of things.
And when any of these are low, hormones, thyroid, adrenals, I mean, you feel it, even though we don't maybe understand that those are low. We need to maybe help boost them up. Look at, the whole body, what's going on, what are we experiencing at this time. Even, good stress is still stress. The body doesn't know the difference between, a traumatic stress or even happy stress. Like, I don't know, a wedding, which can be both traumatic and happy. It's depending. I'm trying to find the happy stressors that we go through. Yeah. But, I don't know, I guess getting ready for a big vacation, even though, so how the body interprets it doesn't know that you're really happy, but you're really stressed.
Yeah, exactly. and how we respond to stress is still the same, like, ancestral reaction of, hey, I'm either, I'm going to flee, I'm going to fight or flight. You still are going to have that same reaction when your brain interprets stress. But I think what happens, we were way back with our ancestors. Hopefully you were only fleeing from the tiger, once a month or once every 6 months. But it's that same stress response of, say you have, a boss that's nagging at you day in, day out. Your brain is still interpreting that as stress, and you're going to have that kind of fight or flight stress response all the time. And we're just not made to deal with that. It's going to have, an effect over time. And I often talk about and you've heard me chat about this with you, the adrenal, thyroid, and male and female hormones. They all really they affect one another, because your brain, the hypothalamus and the pituitary glands in your brain, those two glands control all three of those systems, the adrenal, thyroid, and male and female hormones. So sometimes, going back to like finding the cause, I've had people where at first we think, oh, your adrenals are on too much. They're in this fight or flight mode too much. But then we find out it's actually because they're compensating for a low thyroid function. So kind of going back to that whole of like, wait, we got to take the time to look at the whole picture and figure out what's actually the cause of these symptoms. And so it takes some time sometimes.
Let's talk about too that neurotransmitter disorders. What is a neurotransmitter?
Yeah, so neurotransmitters, sorry, I was trying to think of a funny Elon Musk comment, but I can't. So your neurotransmitters are your brain chemicals. So it's a real broad term for things like serotonin, dopamine, which most people have heard of those. I mentioned epinephrine and norepinephrine, some other really common brain chemicals. Well, one's GABA. Oftentimes people have heard about GABA. What else do I test a lot? Glycine, phenylalanine. But basically, they're chemicals, or not chemicals. They're substances that our body produces. For example, our GI tract, our gut, makes most of our serotonin, like 90% of our serotonin. And serotonin is that brain chemical that many people have heard about, because that's what most of the antidepressant drugs work on. They help your body absorb the serotonin that you have, that you're making better. But think about that. It's interesting how we've got this real gut-brain connection. Sometimes we talk about that like, oh, I have anxiety, and you feel it in your gut. And most of your serotonin is made in your gut. But there's a way to test these brain chemicals. There's a real simple urine test. And they run, you get these levels run, and say we find out, oh, yeah, your serotonin's low, or your epinephrine and norepinephrine are low. How we naturally make these brain chemicals or neurotransmitters are through amino acids. So ideally we get from the protein in our food, but sometimes you can supplement with specific amino acids depending on what you're low in, and your body will kind of then make these neurotransmitters, kind of replenish them. And there's a lot of symptoms associated with low or out of balance neurotransmitter levels, like depression, anxiety, and, insomnia, fatigue, migraines. There's a lot of conditions associated with those neurotransmitter imbalances.
Well, it's just amazing how much our body, is a machine. I mean, we look at how well we take care of, or some of us do, take care of our automobiles, or, our homes, our furnace, our roof, or whatever, all these pieces. And sometimes we just neglect our body sometimes. I mean, I know I've been guilty of that. But once you understand how it works and how life does dump a bunch of stuff on us at any given point in time, but just trying to keep ourselves in an optimal state as best we can, those are things we can control. We can't control what the outside world has got in store for us. But right. All of this, it's just so informative. And I know just through my history working with you, I totally understand and appreciate all of these, and I'm still learning about them as,
Me too.
it's just, and like, oh, okay, now that makes sense. And, when we think hormones, it's not just the ovaries or, there's so much, your hormones are running through our body, and it's not just female, but male too.
Yeah, no, exactly. And I think I think we're all obviously guilty of, just continuing and go. And especially, I'm generalizing, but I hear that a lot from women. Once, I think menopause sometimes when that's the time where the ovaries stop producing estrogen and progesterone. For a lot of women, sometimes it can be a good thing. Like they've raised their kids for the most part, and they stop and they realize, oh, I can't keep doing this. I have to take care of me. So sometimes, as difficult as it can be for some women to go through, it can be a time of like, okay, I need to do things for myself and I just hear this all the time. They feel guilty for taking the time for themselves, but you have to.
Yeah, there's no participation trophy for seeing how much we women can get done. Like, nobody's going to be at the finish line handing you a medal, ever. Yeah. I mean, if anything, Michelle might be there handing you some supplements or antibiotics or something because we've run ourselves down so far. But it is really something to think about, kind of like, where does that come from? Why do we do it? What if it didn't get done? What would happen then? Yeah. Like, I think it'd probably be okay, depending on what it is. But yeah, making ourselves a priority, we struggle with that. And I think it's something that we really need to be curious about.
Yeah. No, I agree. Like, think about even today, there's a lot of folks who, probably couldn't go out because of the roads and the weather and do all the things that they wanted to do or today. And you know what? It's probably just fine. We just get in that hamster wheel mode.
Yeah. And whose voice is it are we listening to? Like, who's beating us up in our head?
Very true.
And like, who is that? Is that just, so it's, and it's never perfect. And it's, we just got to be kind and give ourselves the grace we always give to other people,
Exactly. Oh, and I think that's very interesting. Like you said, but whose voice is telling you that?
And maybe reevaluate that relationship and see what that's all about. So let's talk about these lectures. You've got two coming up. The first one is Saturday, January 20th at 10:30 a.m. And the topic is going to be female bioidentical hormone balancing, focusing on Peri Menopause and Menopause transitions. That's a great discussion. I mean, if anybody's available and either whether or not you're heading into perimenopause or menopause, I mean, it's something just, I think, for women to prepare for and understand and not fear.
Absolutely. Yeah. And in Motion Training Studio, it's a great little gym training studio. Shannon's the owner there, and she's been kind enough she's got a great little space. She's like, oh yeah, come on in, and her clients are going to be there as well as anybody else who wants to come. Yeah, I again, as we've alluded to, I do a lot of hormone balancing and going through menopause. Sometimes women are coming in because they're like, these hot flashes are driving me crazy and I can't sleep and all kinds of things. But the lecture is also going to talk about the benefits of hormones. I mean, there's some a lot of studies coming out now that, estrogen does seem to help prevent dementia. We know it helps keep our bones healthy and strong. So there's a lot of benefits of hormones, and there's a lot of misinformation about hormone replacement, especially for women. This whole other topic based on this Women's Health Initiative study that was going on in the 90s and then got halted very suddenly in 2002, I believe, and they just took women off like all of their hormones. And since that time, there's all information, study after study saying, ooh, we were really wrong about that, a lot of that information. And unfortunately, there's this whole couple generations of doctors who went through medical school who weren't taught anything about hormone replacement for women because everybody thought it was quote unquote bad. So a lot of my patients they're just like, oh, I tried to talk to my primary, and they're like, I don't know anything about it. So that's where I'm hoping to fill in those gaps for people, just explaining what happens with menopause, but also, the benefits and or negatives of hormone replacement, because there's a lot of misinformation out there.
Who do you want attending this, Michelle? What ages or where are they at in life? If somebody's through menopause or in the throes of it, of course, please come to that. Perimenopause, what age does that usually start?
Yeah, that's a great question. And I'm focusing to talk a little bit on perimenopause and menopause, but I have to say, and I'll explain what hormones do throughout your body. Your hormones can be out of balance at any time. Like, I have patients, teenagers, that have some hormone imbalances. And oftentimes with teenagers or someone younger, we can get their hormones back in balance, and then their body kind of goes, oh, okay, this is what I'm supposed to be doing. And they don't have to continue therapy longer. But the average age of the woman goes through menopause, and that's when, if they're still having the menstrual cycles where their periods stop for a year, 12 months, they're done. That's about age 50, 52. But the studies are showing, like, female hormone changes with menopause can start, like, even up to 10 years before that. So it's really, anybody in their 40s on up, and even post-menopausal. And say someone's like, well, I've been menopausal for 2 years now. That's okay. There's certainly some things that we can do, including hormone replacement, at that time as well.
What about surgical menopause?
So that kind of depends if a woman, say they had surgical menopause, only their uterus was taken out, don't have your uterus anymore, not having cycles. Most of the time, they left their ovaries. So for many women, until they get to about, again, age 50, their ovaries will still be producing some hormones. We just don't have their cycles to kind of know where they're at in their cycle to do some testing. So it makes it a little bit trickier. But if a woman still has her ovaries and she's in no uterus, has her ovaries in her 40s into the 50s, we still should be checking her hormones because they are probably changing. Now, if a woman say they had a hysterectomy and they have uterus taken out as well as ovaries, their hormones are going to be low. I mean, there's no doubt about it, because their ovaries are gone. They're definitely a candidate, especially if they, before age 50, there's so many benefits that they're missing out if they just go into menopause at age 40. It's going to affect their bone health and their cardiovascular disease, etc. So sometimes if a woman has had a partial hysterectomy, it's called, still has her ovaries, no uterus, the testing we might have to get a little bit more, we might have to do a few more blood draws, etc., to try to figure out where they're at in their cycle, but it's doable.
And then again on Thursday, January 25th at 6:30 p.m., you'll be talking about thyroid and adrenal disorders, discussing the symptoms, treatments, things that come along with that when things are low, like the fatigue, the weight gain, anxiety, depression. It's amazing how when your body's just out of whack, these areas, the hormones, thyroid, adrenal, how much that impacts all of those things that we women just are like, does it ever stop? That we can we all just get along inside the body so things like this don't happen? But that's at 6:30 p.m. at In Motion Training also.
Yeah, so we just explaining more about how those glands work. As I alluded to, there's these big ranges of normal for testing, and with the adrenals, the traditional way to look at it is either you're making cortisol, so you're good, or if you're not making any, then you're in a disease state. And there's these nuances with that. And talking about different treatment plans, especially for the thyroid. There's a lot of different options and treatment plans that you can do for, prescription supplements. I have a lot of patients that they suspect. They're like, I've always suspected I've had some issues with my adrenal or my thyroid, but they're not in a disease state. Well, it doesn't mean it's not an ideal state. So kind of talking about that and the symptoms to look for and how to treat it and test it.
And both of these lectures are free.
Yes.
And all ages, men, women, everyone's invited to come.
Absolutely. And what I love about the lectures is, sure, I've got the things that the ideas of what I want to talk about, but I love when people ask questions, because usually if someone's asking a question question. There's a few other people who had the same question, and I love to tailor the lecture to what people are curious about. But yes, absolutely, everybody can come. If someone does want to come, it's great for us to know numbers wise. We are asking people to just call my office, and I can give you that number, and tell my staff that they're interested in coming, just so we have a count of how many, or who's coming. You can look on my website, so I have an email there, but the office number is, it sounds like an infomercial here, 541-385-0775.
And what is your website too? Because I'm sure people want more information if they do want to schedule an appointment, learn more about the services that you provide.
Yeah, absolutely. And so that is DR. So it's basically drjacksonnd.com. So it's drjacksonnd.com. Because as naturopaths, after our name, it's ND, as in naturopathic doctor. So that's always confusing, but people forget that double N there.
Well, Michelle, it's been such a pleasure talking with you and getting this information out. And I'm hoping we can do more segments, just especially going into the new year. I mean, everybody's, new year, new me type of thing, or they're at the club and hurting themselves because they haven't been working out or whatever it is. Just try to keep that momentum going and being kind and patient with ourselves so that we can achieve that optimal health that we're all wanting.
Right. Absolutely. Oh, I love that, because there's fads and trends, which there's truths in some of those, and not everything. One size doesn't fit all. So yes, I would love that. It would be very fun to come back on.
Well, this is awesome. So again, the number to call, 541-385-0775. And again, those lectures are Saturday, January 20th at 10:30 a.m. and then Thursday, January 25th at 6:30 p.m. And they're both being held at In Motion Training Studio.
Right.
Awesome. Well, Michelle, I really appreciate this time and look forward to more discussions. Happy New Year.
Thank you, Dawn. You too.
Hey, thanks for listening to the Dawn Newton Podcast. And a special thank you to my guest, Dr. Michelle Jackson, joining us today to talk all things hormones, thyroid, adrenals, just overall health and wellness. If you would like to learn more about Dr. Jackson and her work, maybe reach out to her, schedule an appointment. Her website is drjacksonnd.com. You can also give her office a call, 541-385-0775, or email them at office@drjacksonnd.com. Again, she's also got 2 free lectures happening in January. One scheduled for Saturday, January 20th at 10:30 a.m. The topic is Bioidentical Hormone Replacement. The second lecture takes place on Thursday, January 25th at 6:30 p.m. And this lecture will feature adrenal and thyroid disorders. Both of these lectures are free, and they are being held at In Motion Training Studio, located at 1279 Northeast 2nd Street here in Bend. Again, if you would like to reach out to Dr. Jackson for the lectures, drjacksonnd.com is the place to go. And be sure and check out my website, dawnnewton.com. The Dawn Newton Podcast is written, produced, and hosted by Dawn Newton.